Hello, my name is Casey. I am a nursing student with Muskegon Community College. I have some couple things that I want to go through with you. This should only take about 20 minutes. This is a health history assessment. How are you doing today?
Good.
Doing okay?
Yeah.
Good. All right. So can you start by verifying your name and birth date for me?
I'm Robin Coxon. It's 2/26/88.
Okay, perfect. All right. Is there anything that you wish to be addressed as?
Robin.
Robin, okay. All right. So, is there anything in particular that brought you in today?
Pelvic pain.
Okay. Beside the pelvic pain, do you have any other health concerns that you would like to discuss? Okay. All right. Is there anything with the pelvic pain? Is there something that you can elaborate a little bit more on that?
It just feels like stabbing knives in the pelvic area.
Okay.
Feels like I had endometriosis previously, and it feels like that.
Okay. All right. Have you ever had a communicable disease?
No.
Okay. Have you had any immunizations?
Yes.
Okay.
I'm up to date on all of them.
Okay, good. Have you gotten the pneumonia vaccine?
No.
Okay. How about the influenza one?
Yes.
Okay. Do you know about when?
October of 2019.
Okay. Any medication allergies?
No.
Okay. Do you take any current medications?
Yes.
What do you take?
Estrace.
Okay.
I take that once daily.
Okay.
And then ibuprofen as needed.
Okay. All right. With your Estrace or ibuprofen, do you have any medications with your, or do you have any questions about your medications?
No.
Okay. Do you take your medications as prescribed?
Yes.
Okay. Good. Any problems with the medications that you currently take?
No.
No? All right. Do you smoke?
No.
Okay. Do you take in any caffeine?
Yes.
Okay. About how much?
Probably at least 3 cups a day.
Okay.
Sometimes more.
Okay. What do you consume?
Coffee or energy drinks.
Okay.
Even though I know they're really bad for you.
Okay. All right. Do you drink any alcohol?
Occasionally.
Okay. About how much or how often?
Maybe once a month.
Okay. And is there a specific type of alcohol that you will usually consume?
Usually wine.
Okay. Do you use any other substances like cocaine, speed, or marijuana?
No.
Do you have any known allergies or intolerances to food?
No.
Okay. Any surgical history?
Yes.
Okay. What have you had?
I got my appendix removed.
Okay.
I've had my gallbladder removed.
Okay.
And I had a complete hysterectomy.
Okay. All right. Do you know about the time frame you had your appendix out?
That was in like 2012, and
Okay.
then like a year later I had to get my gallbladder removed.
Okay.
And then in 2015 is when I had my complete hysterectomy.
Okay. And do you know what the purpose was for those surgeries?
Well, I had appendicitis and I had
Okay.
gallstones, and
Okay.
then I suffered for many years with endometriosis
Okay.
and cysts on my ovaries.
Okay. Okay.
And so it got to a point that it was so bad that I had to get everything removed.
Okay.
So.
Okay. Have you had any type of hospitalizations or overnight stays?
Yes.
Okay.
In 2018,
Mhm.
in December, the end of December, ever since I had my gallbladder removed, I still get bile duct spasms.
Okay.
And sometimes I'll even produce stones as well, even
Okay.
though my gallbladder is no longer there.
Okay.
And so I was admitted for 3 days because my bile duct was dilated. I think like the normal is like maybe 7 or something, and it was like 16. But anyways, I had to stay for like 3 days and get a scope done and all that. So.
Okay. Good.
And then all 3 of my kids' births, I was in the hospital. So.
Okay. Awesome. All right. Any accident or trauma history?
No.
No. Any recent falls?
No.
No. Okay. Do you have any family history of heart disease, diabetes, high blood pressure, stroke?
My mom has high blood pressure, and my aunt had cancer, but other than that, no.
Okay. All right. All right. So for respiratory, do you have any type of breathing problems?
Mm-mm.
No? Okay. Do you know when your last TB test for tuberculosis was?
I think it was in 2018.
2018?
Yeah.
Okay. Do you happen to know what the results were?
Negative.
Okay. Any history of pneumonia or lung surgeries?
No.
Okay. All right. So, do you have any type of usual daily activity or exercise?
I try to exercise at least a half hour a day, at least.
Okay.
I'm very busy with the kids and all that, so I mean, I'm constantly moving.
Okay.
Yep.
Okay. All right. So for your exercise, do you think that your exercise routine is poor, fair, or good?
I mean, I think it's fair. Some days it's good, some days it's not as good as other days.
Okay. Okay. Any problems with chest pain or
No.
heart palpitations? No? Okay. Do you ever get any dizziness? Okay. Any history of high blood pressure, leg cramps, or cramping when you're exercising?
No.
No? Okay.
I try to stay hydrated so that way then I don't get the cramping.
Very good. History of heart disease, heart attack, or heart surgery?
No.
Okay. All right, so for fluid and nutritional balance, maybe you could give me a little bit of insight on what your food or fluid intake is like on a 24-hour basis. So, like for breakfast, what would you typically have?
Some days I don't eat breakfast at all.
Okay.
I try to just because it gives me more energy, but I mean, like I said, it's a busy time, and sometimes I'll just drink coffee for breakfast. But normally eggs, scrambled eggs, I'll eat those. Bagel.
Okay.
Stuff like that.
Okay. Now, when you're eating breakfast, is that usually when you consume your 3 cups of coffee? Or from the time you get up to the time you leave?
Yeah.
Okay.
And, well, yeah, pretty much.
Okay.
And then, like, afternoon, I'll drink a energy drink or something.
Okay. Okay. Okay, so how about for lunch? Do you typically eat lunch? What would you typically have?
A sandwich or, vegetables, hummus. I love those.
Okay.
Not usually anything too much.
Okay.
Yeah.
Okay.
That's about it.
Okay. Now, how about for dinner? What does that usually look like?
I mean, it's pretty much centered around my children.
Okay.
Well, I mean, that's like our one time to sit down together and be together.
Yeah.
So that's kind of like an important meal for us all. But, I mean, I cook a lot of vegetables, meats.
Okay.
My kids like chicken and, rice and pasta, stuff like that.
Okay.
So.
Okay.
Or anything that goes in a crock pot because that's like my life.
Okay. Okay. Now, during the day or throughout the day, do you find that you snack?
Not really.
Okay.
I mean, I might like bring some pretzels or something,
Okay.
especially like when I'm at school or at work. But I feel like I just don't have that time.
Okay.
So,
Okay. Okay, so when you are eating, who typically prepares your meals?
Me.
Okay. Now, have you had any recent weight gain or weight loss?
No, not really.
Okay. Any appetite changes?
No.
No. Have you noticed any type of excessive thirst? No. Okay. Do you know about how much water you take in per day?
I try to at least do 64 ounces.
Okay.
Sometimes more, sometimes a little less.
Okay. All right. Now, are you satisfied with your weight?
Yeah, I mean, definitely that's been my goal over the last, few months is be more, like aware of that.
Okay.
I'm not so much unsatisfied with my weight, but I just want to feel healthier. So
Okay.
it's more about my health than my weight, actually.
Okay.
So
Okay. Awesome. All right. So now we have this thing. It's called My Plate. This is about how many or about serving size of fruits and vegetables and protein and grains, and what our plate should look like at each meal.
can I draw my plate?
Sure. Go ahead.
So protein and veggies are probably the main thing.
Okay.
And not so many fruits,
Okay.
even though my kids love pineapple. And then not so many grains as well.
Okay.
There you go.
Good. Okay. Very good. Looks pretty good. So as far as dental health, because that is very important, do you have any dental problems? Bleeding gums, cavities, broken teeth? Do you lose teeth?
No.
No? Okay. Do you know when your last dental exam was?
Just in November of last year.
Okay. And can you tell me what your daily dental routines or habits are?
I usually brush morning and night and then floss.
Okay, good. Now, do you floss once a day?
Once
twice
a day.
Okay, okay. Okay. Now, you mentioned that you had your gallbladder removed.
Yes.
Because you had gallstones. Okay. Do you have any history of diabetes?
No.
No? Okay. All right. So for the next segment, we have gastrointestinal questions. Do you have any difficulty eating, chewing, swallowing? No? Okay. Any problems with your bowel pattern?
No.
No? Okay. Now, can you tell me when your last bowel movement was?
Today.
Okay. Is there frequency? Do you ever get constipated?
No.
No. Is the color and consistency, does
Normal.
it change? Normal?
Yeah.
Okay. No diarrhea? Okay. All right. Any problems with urination?
No.
No? Okay. Any burning, urgency, or hesitancy?
No.
Okay. Do you have any history of urinary tract infections?
Nope.
No? Okay. Any difficulty holding your urine? No?
Well, maybe.
Maybe?
Since I've had kids.
Okay.
Like when you sneeze or stuff, but
Okay.
not just for no reason.
Okay. Okay. Have you ever noticed any blood in your urine?
No.
Do you, when you go to the bathroom, do you empty your bladder completely?
Yes.
Okay. All right. So, the next segment, we'll talk about comfort and hygiene. Have you ever experienced any hair loss?
No.
No. Any dry scalp, dandruff?
No.
Okay. Any history of brittle nails?
No.
Dry skin, itchy skin, skin lesions?
No.
No. Now, do you use any skin products?
No.
No. Do you use
Lotion, stuff like that. but
Lotion?
Nothing, yeah.
Okay. Do you use sunscreens?
Yes.
Okay. All right. So this kind of touches back on what you're actually here for today. Currently experiencing pain?
Yes.
Okay. What would you rate your pain at?
A 4.
About a 4? Okay. Now the location being pelvic?
Mm-hmm.
Okay. And again, earlier you mentioned that it was like a stabbing pain, correct? Okay. Is there anything that makes your pain worse?
Like walking.
Okay. Being up and moving?
Mm-hmm.
Okay. Is there anything in particular that helps alleviate your pain or make your pain feel better?
Heat.
Heat? Okay. Have you noticed any other symptoms that are associated with your pain?
No.
No? Okay. So, for your sleep habits, about how much sleep would you say that you maybe get a night?
I'd say anywhere from 7 to 8 hours.
Okay. Do you ever have any difficulty falling asleep?
No.
Any difficulty staying asleep?
No.
No? Do you ever take any medications to help you sleep?
No.
No? Okay. And how about any naps? Do you usually take naps? No? Okay.
I don't have time for that.
Okay. Have you noticed any limitations with type of movement, mobility?
Mm-mm.
No?
No.
Any history of arthritis, back pain, muscle ache, or joint pain?
Nope.
No? All right. Moving right along. Any history of glasses? Well,
Yes.
look like you have glasses on. Okay. Do you know when your last eye exam was?
June of last year.
Okay. Were there any vision changes?
No.
No.
I've had the same prescription for like the past 5 years.
Okay. Have you ever had any glaucoma?
Nope.
Or okay. All right. Have you had any history of hearing aids or type of hearing loss?
No.
No. Do you know when your last hearing test was?
No. Probably in grade school.
Okay. All right. Any like ear infections or ringing inside your ears?
No.
No. Any changes in taste or smell?
No.
No. Any numbness anywhere? No. Any dizziness or blackouts?
No.
Mood changes?
No.
Dizziness? Seizures? No? Okay. Okay. So for our female parts, what was the first day of your last menstrual period?
Probably 2015.
Okay.
Before I got my hysterectomy.
Okay. So are you currently in menopause?
They call it surgical menopause.
Okay.
But I'm taking hormones.
Okay.
To kind of like keep me out of it, but
Okay.
it's technically yes.
Okay.
Surgical menopause.
Okay. So you do not have a period, so no difficulty with menstruation,
No.
right? Okay.
I did previously before the hysterectomy.
Okay.
Yes.
With the endometriosis
Yes.
and whatnot. Okay.
Yes.
All right. Last pap smear?
Now that I had a hysterectomy,
Mm-hmm.
I still have a cervix, so I only have to do it every 5 years. So, but it was done a year and a half ago. So.
Okay. So like January, February
Yes.
of last year. Okay.
Yes.
Do you know the results?
Everything was normal.
Normal. Okay.
Mhm.
All right. Do you have any children?
Yes.
Okay.
3.
Okay. Do you ever perform self-breast exams?
No.
Okay. Have you ever noticed any lumps or discharge
No.
or pain? No? Okay. And you are not over 40. No vaginal discharge or sores or
No.
anything like that. Okay. Any type of contraception?
No.
Okay. All right. So for your well-being, who is your support system?
My family or my
Family?
kids. Yeah.
Okay. Now, is there anybody that you live with now?
Yes, my kids
Okay.
and myself.
Okay. Are you satisfied with your living environment?
Yeah.
Okay. Now, do you have a single story? Do you have multiple levels in your
It's
house?
a house. I mean, it's a 3-story house, but
Okay, so you have stairs.
Yes.
And, okay. All right.
like basement, main level, and upstairs.
Okay. Do you have any pets?
Yeah, 2 cats.
Okay. Now, do you feel safe in your living environment?
Mm-hmm.
Okay. So, for a health rating on a scale of 1 to 10, where would you say that you would be?
Probably a 6.
Probably about a 6.
Mhm.
Okay. For health goals, is there something that is really important to you? Most important health goals?
Like I said earlier, I think just feeling healthy.
Okay.
I want to get to that point.
Okay.
So,
Okay. What do you do to be healthy? I know you mentioned you try to exercise most days. Is there anything else that you would like to add to that?
I just try to drink as much water as I can. I
Okay.
stay away from pop and sweets and stuff like that.
Okay.
So.
Okay. All right. So, education. What is the highest grade level that you have completed?
Some college.
Okay.
Yeah.
Can you elaborate a little bit more?
Well, I graduated high school,
Uh-huh.
and then I did my CNA.
Okay.
Then after that, I went back and did my EMT basic
Okay.
course.
Mhm.
So those are all college level, but it's like
Yeah.
certificates.
Okay.
And then I started the nursing program at Baker.
Okay.
And that was just kind of crazy.
Okay.
And then I came over here. So yeah,
Okay.
I mean, probably enough college.
Okay.
But
Okay.
not any degree yet.
Okay.
So just certificates.
Okay. Are you satisfied with your career?
Yes.
Okay. Now, have you had any major life changes or anything?
No, just, starting the nursing program and all of that.
Okay.
But no.
Okay.
And
Good.
just all the excitement of kids.
Okay,
But,
good.
Yeah.
Good. Now, I know probably with school comes stress, but do you have any current stress or fears or concerns with family or work or anything like that?
I think it's just healthy stress.
Okay.
I cope with it pretty well, so
Okay,
yeah.
good. Okay. Is there anything in particular that you use to cope with stress?
I exercise,
Okay.
hey, my kids
Mhm.
are wonderful
Mhm.
at helping me just
Mhm.
kind of, forget about
Mhm.
the daily stress.
Okay.
And sometimes they cause stress, so.
Okay, okay,
But, yeah.
okay,
Just normal stuff.
okay. Any history of mood swings, depression, or anxiety?
No.
No. Sources of hope or strength? Any religious things that you do?
No, I mean, me and the girls go to church every Sunday and stuff like that.
Okay.
But no, nothing in particular.
Okay. How about any greatest personal strengths? What do you think that you do that you're strong at?
I think I have good communication skills
Okay.
with people.
Mhm.
I think I'm a people person.
Okay.
Yeah.
Okay.
I'm easy to get along with.
Good, good. So with that being said, do you feel that you have control over the future?
I want to say yes.
Okay.
But obviously I know that
Mhm.
it's not always the case.
Okay.
But
Okay.
yeah, I like to have things planned and
Okay.
kind of be in control a little
Okay.
bit.
Okay. All right. So we're going to be concluding here soon.
Okay.
What health benefits will impact what health beliefs will impact your healthcare at this point in time?
Like just my idea of like more water intake and exercising and taking that self-care.
Okay.
So.
Okay. So if a nurse comes in your room and says, "I'll be right back with your medication," about how long would you give that nurse before hitting that call button?
It all depends. You know, I'm not the one to complain or, you know, but if I was in extreme pain, you know, I would say half hour to an hour.
Okay. Who makes health care decisions for you or in your family?
Me.
Okay. Over what areas of your health do you feel that you have control?
Most all of them.
Okay.
I mean, obviously the stuff I can't, you know, prevent from happening, you know, but I want to say that I'm in control of all of it.
Okay, very good. Now, when you're ill or not feeling well, is there certain things that you typically tend to eat or do when you don't feel good?
You know, like I try to increase fluids and, you know, eat bland foods normally.
Okay. Now, when you're sick, is there anybody that you typically want close by to you during that healing process?
My family and my kids.
Okay, all right. So, how would you prefer things done when you're teaching and learning information? Would you prefer things to be written or demonstrated?
I think demonstrated.
Demonstrated?
Learn by watching someone do it and then me do it myself.
Okay, okay. Verbal pictures or videos, do those type of demonstrations help
Sometimes,
you?
yeah. It depends on what it's for.
Okay. All right. So is there anything that you would like to talk about that we have not yet already identified?
No.
Okay. All right. So, for our summary, your name is Robin Coxon. You are 31. You're here for pelvic pain. You do not have any known drug allergies. You take estrace for your surgical menopause. You take it daily. You don't currently smoke. You consume about 3 cups of caffeine a day, and wine maybe once a month. You have a few surgeries. You had your appendix removed, your gallbladder, and a complete hysterectomy, which is why you take the estrace, correct? You've only had the hospitalizations for those surgeries.
Yep.
No respiratory or cardiovascular or heart problems or anything like that, correct? No problems with bowel movements or urination. No problems with skin or sleep habits or anything like that. All right. You do currently wear glasses and recently had an eye exam. You seem like you are pretty satisfied overall with your well-being.
Yep.
You live at home with your 3 kids and your cats. You do exercise on a pretty regular basis. And overall, you feel good about yourself. Okay? All right. Good. So now for the objective piece. Overall, the Robin is open and clear with her concerns. She accepts touch. She does not pull away or withdrawals. She does not startle easily. She, for nonverbal communication, responds well to gestures, facial expressions, and eye contact. And the patient felt most comfortable 18 inches to 3 feet away.